Chicago is #1 in a horrifying statistic. Our young people have the highest rate of gonorrhea in the country. Teenagers are learning hard lessons about unprotected sex. Critics say they should be better protected by education. Schools teaching reading, writing, and risk.
What did you learn about sex in high school or grammar school?
I didn't learn about nothing. I didn't learn nothing about sex.
She doesn't want to be identified, so we'll call her Joanne, a 20-year-old with 2 children. Her first pregnancy was at age 14. 2 years later, she learned a new word, the hard way.
Had you ever even heard of chlamydia?
No.
You didn't even know what it was? And what was your first reaction?
I was mad. Really mad.
Joanne was mad at the boy, but he'd never heard of chlamydia either. Critics argue that's why Chicago ranks #2 in the country for rates of that sexually transmitted disease among 15 to 19-year-olds, and #1 in gonorrhea.
Every time I do a presentation, I give the stats. Folks are blown away, and they're appalled, and they should be. The rates of infection among this age group is astronomical.
It's epidemic.
It's epidemic, correct.
Ira Rounsaville is the HIV prevention specialist for Chicago Public Schools. He and one staff member coordinate sex ed for the entire district. Obviously, help wanted.
Somebody that watched the video maybe saw that, oh, that's me. I need to change my ways. I need to go get help.
Getting teenagers to help spread the word among themselves is the idea behind a contest sponsored by Walgreens. This is the 5th year of the Expressions Challenge. This student team from Dunbar High School won the $2,000 prize last year for their video encouraging teens to get help if they are HIV positive.
You know, their peers are teens, so they listen to their peers more than they listen to like their parents or adults. It's a better outlook when a teen is addressing the situation.
The retailer stepped up the prize money and the marketing this year. Stepping into the arena of sex ed takes some corporate courage.
There's no corporate backing, so to speak, to really catapult conversation about sexual responsibility, and we've reached out to many of our key academic partners.
University of Chicago researcher Dexter Voisin says children are suffering while adults argue politics or morality.
We have all these issues around sexuality, but the reality is we have to protect our youth. And so when you look at countries like Denmark and other European countries, they have a fraction of the STI cases that we have in the United States.
Fueled by the staggering statistics here, CPS now has clinics adjacent to several high schools.
We offer testing as well for gonorrhea and chlamydia in the high schools, and we've been doing that. This is our 3rd year for that.
Programs like the Walgreens Expressions Challenge are getting more official support, and they are expanding. The comprehensive sexual health education policy the school board adopted 3 years ago calls for every student to get 675 minutes of sex ed by the 5th grade, but it's an expectation, not a mandate.
I think we should change that. It's important for kids to have the education and to make better choices.
What is it that you've learned since then that would have helped you a lot had you learned it earlier?
All about STDs, HIV, AIDS, pregnancy, prevention, places to get help, self-esteem, everything that a woman needs to grow and to learn.
So if parents press for more curriculum about sexual health, the idea is principals will buy into what the board has already set as policy but doesn't really enforce in a vigorous way, and that starting in kindergarten, kids should start hearing about sexual health. By the end of the 5th grade, they should all have many, many hours of sex ed, which only then should become more intense, more specific as they get older.
And how would the changing length of a school day
every
fit
minute,
into all this?
Every minute is precious, as we've seen over this debate. And one thing they found in this Walgreens Expressions Challenge is by interweaving it into other disciplines. You can do it in art, you can do it in literature, you can do it in your broadcast class, you can do it in your
Probably
science
more
class.
Effective that way.
Exactly, kind of weave it in and out of their existing curriculum. What happens is the kids start researching it, learning about it, then they go home and they start the conversations with parents, which ideally is where all this would happen, but it's obviously not.
And in those countries where there's just a fraction of the cases we have here, any definitive reasons?
Well, it's not because they're any less sexually active. In fact, sometimes they are, just based on the information that they have. A couple of kids I talked to, and I was saying, parents don't want you to start talking to you about sex and encourage you to have more or to be more inclined to do so. They said, hey, once you hear all the things that can happen to you from having sex, you don't trust that protection as 100%. You just say, forget it, I'll wait till later. So it can actually discourage them from engaging in sex early. And just based on our teen pregnancy rates and how young that's happening, there's a lot of unprotected sex going on out there.
Yeah, important story to stay on.
Yeah.